Okay, so now we're going to be talking about sigmoid diverticula and diverticulitis, and this is going to be a short one because it's a very small question. But I'm also going to be talking about diverticulosis because these terms are very easily confused. Now let's talk about sigmoid diverticula. First of all, you need to understand that this is not a Meckel's diverticulum or or Zenker's diverticulum, for example, because these are most common ones that are known and they're easily confused. Remember that diverticula can occur within the esophagus, it can occur within the small intestine, and it can occur in the colon. And when we talk about sigmoid diverticula, we're talking about the colonic diverticula. Now, when you talk about the sigmoid diverticula, they are basically pseudodiverticulum. So what are these? Pseudodiverticulum is like an outpouching of the mucosa and the submucosa in which not all of the layers of the walls are involved. So in this case, the muscularis propria is not involved. However, in the picture you can see. So in true diverticulum, all of the layers are involved. Now, why does this occur? What is the most common location? So within the sigmoid colon, we have these penetrating we can say vasa recta, okay, these vessels which are penetrating the muscularis propria, and these locations are very vulnerable to the formation of a diverticula because obviously it's a weak spot. So that's one thing you need to know. Furthermore, okay, now we can, after explaining this, let's go on to the scheme that we follow, right? So first of all, let's talk about the epidemiology. It is present in 40% of the population, and the one thing that they really love to do is linking different diseases. So, for example, what disease would you see sigmoid diverticula in? For example, like syndromes, basically. So, for example, it would be Marfan syndrome, it can be Ehlers-Danlos syndrome, it can be adult polycystic kidney disease in which you would see a colonic diverticula. Now, another very important part of this question would be the let's talk about the etiology now. Etiology, we would expect more like wall stress, acquired wall stress. It can be due to constipation or it can be due to a low fiber diet, right? Then we can talk about some of the complications. Now, complications, we talk about obstruction. The reason that obstruction is a complication because like there can be scarring that can basically occur because of the diverticula, which can lead to, we can say, constriction and narrowing of the we can say lumen, right? Furthermore, we can talk about diverticulitis. Now, diverticulitis, by litis, you can understand it is some kind of inflammation, and it's the inflammation of the diverticula. So often it is like due to the the stool that is accumulating, or we can say impacted stool in the sac, which leads to ulcerations and then leads to ischemia. Obviously, we can also have rectal bleeding because of the vessel proximity. As I said, that where does the diverticula occur? It occurs where the vessel is penetrating the muscularis propria. So what will happen if the diverticula will occur over there? Obviously, it can lead to damage to the vessel, leading to bleeding, right? And normally, what would we see? We would see hematocesia. What is hematocesia? It's bright red stool because of the blood. Then we have perforation. Obviously, why are we so scared of perforation? Because it can lead to peritonitis, right? It can lead to an acute abdomen, for example. Then we have fistulas, for example. In the case of fistula, we can see connections between, what is a fistula, first of all? Fistula is connection. These connections can be made between every organ or hollow structures, for example. So connections between the hollow structures, often we see colovesicular fistula. What is a colovesicular fistula? It is a connection between the colon and the urinary bladder. So this is basically what you need to say for sigmoid diverticula. So half of your question is done. Next, we go to diverticulitis. Now, diverticulitis, again, litis gives it away. It's an inflammation. It is a purulent inflammation of the diverticula. Okay, why does this we can say diverticulitis occur? It is due to, for example, imagine if there's an increased pressure on a particular structure, eventually what will happen? It starts to erode the mucosa, which can lead to inflammation and bacterial infections, obviously, because those layers shouldn't be exposed, but they're exposed and now they're more vulnerable. And we already have a lot of flora that is present within the intestines, right? Okay. Other mechanism is that, for example, the fecal matter is being obstructed and obstructs the communication with the lumen, and this can lead to infection. Now, clinical features that the patient would present with is like colovesicular fistulas, as I already talked about, that there would be connection with the bladder. And what would we see in the bladder in this case? Very interesting. We would see feces and we would actually see gas within the bladder. Perforations, obviously, we can see peritonitis, we can see acute abdomen, for example, and we can have abscess formation. Now, fistulas are actually the most common cause of the most common cause of this diverticulas, and diverticulitis is actually the most common cause of the formation of these fistulas. Okay, and yeah, mostly also the patient would present with like a lower quadrant pain, left sided. It looks like a left-sided appendicitis, because normally we would feel appendicitis on the right side, but in these patients they would actually complain of a left-sided pain in the same location, like it's a left-sided appendicitis. Okay, so that's also something that they would be interested in. So in the pictures, it's quite obvious. Like here, you can see the diverticulum. Here, you can see diverticulitis. The difference between diverticulosis and diverticulitis is very clear over here. That in diverticulitis, you would see inflammation, even if there are multiple diverticulas. But in diverticulosis, it is without inflammation. It is without the inflammation. It is without the, we can say, it is normally asymptomatic, or it is basically without the infection and inflammation. So prevalence of diverticulosis, let's go through the scheme again. So we said that 50% of all people who are above 60 years old have it. Okay. So it's very common in the elderly. Clinically, it is asymptomatic. It is normally an incidental finding. And these patients can actually complain, or they can complain like of a cramping pain in the lower left quadrant, right? Etiology, it's due to increased pressure and due to a weak wall. It can be due to poor diet of the West, for example, mostly it's due to low fiber, more fat or meat, which increases the intraluminal pressure and less bulk and stronger peristalsis. So also no activity, obesity can lead to it. Again, what would you link diverticulosis with? Marfan syndrome and Ehlers-Danlos syndrome, right? Due to weakened collagen, there's a weak wall. Okay. Next, let's go on to the complications. Please remember the complications. They're very important. They can ask you, oh, okay, if the patient has this, what can it lead to, right? So bleeding is one of the most common complication, or so most common cause of the lower GI bleeding is diverticulosis. And we can also have acute inflammation, in which we could see diverticulitis. And normally the treatment is a high fiber diet, fluids, and resection in some cases. Another thing I would also like to mention is that when we're talking about uh, what is it? Oh, one second. Oh yeah, when we're talking about, for example, diverticulitis, for the diagnosis, we can actually use a Hinky classification, in which case we're basically using CT. Now, the reason that we're using CT in diverticulitis is to understand if it's a complicated diverticulitis, in which maybe I already mentioned the complications, perforation, abscess, or whatever, or we can have like non-complicated diverticulitis, which is without the complications. And obviously, in diverticulitis, the treatment is antibiotics or some kind of surgical repair. For diverticulosis, I've mentioned the treatment. For yeah, so that's pretty much it. For diverticula, another thing you can understand is that the most common site we already know, but usually it is incidental finding. But since the diverticula are actually stretched, they can actually erode and actually rupture the vessels and lead to bleeding, right? Okay, so that's basically it. That's everything you need to know. Make sure you understand the difference between a diverticula, a diverticulitis, and diverticulosis, because this is most common question that they can ask you. and I hope it helped. Thank you.